So again, good afternoon to everyone. Our topic for today will be on the hospital information system. So our learning objectives will definitely focus on the use of the Beatsbox. Beatsbox is actually a platform that are being used now in most of the hospitals for the implementation of the hospital information systems. So I will be orienting you on how this hospital information system is working, and even a MCO hospital is using the Beats box. I think this is version 8. So first and foremost, I'll start uh, with the video presentation on what is e-health, because the e-health concept is connected on how the hospital information system evolved on the use of these platforms for the various processes of healthcare facilities. So actually, when it comes to the e-health, we are thinking about on how this e-health means, because we are used to the e-commerce, the e-health. But when it comes to e-health, it's very obvious that we are using the technology, and at the same time how we will achieve uh, the health needs of every individual. So in everyday life of an individual, since due to the restrictions, there are various concerns that made us have limitations when it comes to access of services. Since each one of us in varied setting and population groups have different needs. So the E stands for the electronic, which is technology, and the health is, as defined by the World Health Organization, is the state of wellness. Nowadays, we are living with the digital technology and using of the various platforms and gadgets as well. So actually, the purpose of the e-health is for the better healthcare, and okay, and eventually, let's continue. And eventually, the digital technology will have now the chance to have a better sharing of information. Digitization of the records, meaning we could now access the scanned documents even through our own mobile phones. Um, Shared information with protection through our Data Privacy Act, because every institution can just facilitate and use the system of e-health if it is in conformance with the law, which is the Data Privacy Act. So quickly we can access results of diagnostic examinations, and even in our own homes, we can secure high quality of information to also promote high level of independence, even in the absence of doctors, or if the doctors and nurses are on a remote area. We can easily access information and diagnose immediately individuals, and receive appropriate treatment as well. Wherever needed, this information can be accessed by healthcare individuals so that to facilitate immediate attention. So as mentioned, we are having teleconsultation, we are having the telehealth, we are having the telemedicine. The sharing of information, just like now, is the use of the technology and various platforms. So just like a typical example of a clinical portal, well, in the patient as a stakeholder can already access basic information whenever the client had been hospitalized or will have a certain appointment for face-to-face consultation. Actually, eHealth will enable us to gather rich data. If we say rich data, it can access important information that will be very useful even in our own health. Even video consultations or recorded video uh, health educations can be accessed on the hospital information system. As we have the term advances in technology, just like for diabetes monitoring, the persons or individuals can just monitor the glucose monitor and have the doctor be updated through the connection of the hospital information system. The client will be given an ID, and the doctor will be given also a separate ID for the access of one platform in hospital information system. It can easily notify how the patient will have his own intervention, even the doctors are on a remote area. It may enable the people or the persons to manage their own health, the enabling capacity. And with this monitoring, he could be alarmed, he could be alerted with the available information. Trust is one of our common denominator when it comes to relationship of nurse-client care management. The access to these advices and information that are needed in the 24 hours will be very helpful on how to promote and prevent diseases. With our own health, this could have this password, so that's for protection, and there are different tools available. Eventually, to lead a healthier life, e-health is very flexible in terms of how it will fit to your needs, even in your busy lives. Even in your own mobile phones, in your own tablets, there are already existing applications. Since these informations can only be access already in some of the platforms, it can use some of the online portals, and these online portals can access to the services of the hospitals. Example, e-prescriptions. The e-prescriptions can be available even on a remote capacity of the hospital. So in the future, what comes next with the e-health? E-health has the potential to lead to a direction on how we will improve. Kasi the term revolutionize is the use of the technology to further improve health, to better promote health to the families, and best for the communities. So eventually, this rich data can be used for recommendation on how to improve the operations of the hospital and as well satisfy the clients. This will definitely access to new trends and updates, so that it will have an updated treatment for the client. Even with the protection of data, this must be safe and secure. And this must be one of the advocacy of nurses to promote e-health, to promote healthcare of our client. So it is a collaborative effort, and it is our endeavor to promote health informatics. So for now, our main topic for this afternoon is related to one of the platforms when it comes to hospital information system. I will be showing to you a video. These videos that I am now showing in our discussion are uploaded also in our Central Lido Pit Stop for you to view again, so that you can grasp the important details. So I will present to you the Bitsbox platform, the Hospital Information System.
We are proud to introduce to you the BizBox Hospital System 8. This is a fully integrated and comprehensive healthcare solution that will help hospitals as well as their personnel with their specific tasks and responsibilities to their patients. The system is composed of the following: the BizBox Hospital Information System, the Financial Management System, Materials Management System, Clinic System and Electronic Medical Record System. Let's start with the BizBox Hospital Information System and discuss the healthcare business process. This includes the processes of patient registration, requisitions, and transactions in the ancillary, billing and cashier. The registration of an inpatient is easy using the Inpatients module, wherein you can view all the admitted patients that are in the hospital. In addition, you can manage the records of these patients that include their profile and registry details. There is an additional feature of the system, wherein it can detect if the name of the patient matches to an existing record. That will be an identifying factor if the patient is old or new on the hospital records. The system can also identify if the patient to be admitted is absconded, and will post a notification that the patient was unable to settle his account from his last visit in the hospital. There are also different transactions that the admitting department can perform. First, we can relocate a patient from one room to another. We also have access to discharge the patient and readmit if the patient decides to come back to the hospital. The summaries will serve as statistics of all the patients in the hospital depending on their status. On the nursing services, which is the nursing department's primary access, we can tag the patient's arrival, that came from the admitting department, for us to be able to get ready for their requests and needs. Requesting for an item or service will require us to specify which department that service is coming from. The inventory balance will show the available items that are ready to be given to the patient. The examination of shots can also be accessed here, that will contain the different examinations done to the patient, as well as the results. The access of this information will depend on the nurse that is assigned to the station where the patient is. The nursing endorsement sheet will be used as a notification to the nurse that will be next on duty. We can also view the list of medicines the patient has taken throughout his stay in the hospital. The ancillary services will list down the different requests of the nursing services, based on the patient's needs. The access of this will depend on the assigned personnel to the different ancillary departments. We can render the requisitions here, and we can also render directly without requiring a request coming from the nursing services. There are also instances where people would like to avail items from the hospital, even if they are not registered, and that will be the purpose of the cash transaction module. In addition, there is also an MGH clearance alert that will notify the particular ancillary department if the patient was tagged for may go home clearance. Using the examination of shots module, we can access and manage the different examinations that were done to the patient. Since every hospital has their own different ways in presenting different examinations to their patients, the hospital system has the capability to let the users design and create their own examination templates that are applicable to their hospital. In this case, using the tools on the examination subcomponents, more specifically the tables and templates, we can create our own examination templates based on the hospital's standards. After the process of creating the examination templates, we can now manage the examination and enter the results on the fields. After finalizing the examination results, we can now release the information to the patient, and also let the nursing services have access to these results. In addition, we can also lock the examination, for us to secure the data and avoid unauthorized access, or unlock to modify or finalize these examinations. The billing department will be responsible of posting different charges to the patient's account, based on the hospital transactions, or the items and services he availed. We can charge the patient for the professional fee of the assigned doctor. And also, we can post a discount, if the patient is eligible to avail one. The post-AR transfer is for patients with guarantor. This is used to transfer the account of the patient to the guarantor assigned. This transaction will automatically be recorded on the billing schedule module. Debit room charge will charge the patient for his use of the hospital room. The SOA billing statement will list all the charges accumulated by the patient based on the hospital services and items that he received. In addition, we can also generate and print the statement of account report of the selected patient. The cash receipts module is the primary function of the cashier in the hospital. This is where all the payments of the patients are being collected. We can receive different types of payments. It can be through cash, card, check, or other types that the patient chose to pay his bills. The patient also has an option to deposit a payment, even if he doesn't have a hospital transaction yet. In addition, this module can also summarize all the collections made by the cashier in charge for the day. Generally, after the hospital received the payment from the patient, it is now time for the patient to be cleared from all the transactions tagged as may go home, and lastly to be discharged from the hospital. These processes are also the additional responsibilities of the nursing services. In addition to the BizBox Hospital Information System, there is also the Financial Management System that is in charge of the preparation of different financial reports. This is a comprehensive accounting system that's seamlessly integrated with the front-end hospital transactions, eliminating redundant and erroneous entries. It also includes dashboards, cost center, and financial and income statements. The materials management system focuses on monitoring inventories of medicines and supplies in the hospital. Tracking these information is done electronically, which will encourage the hospitals to go paperless. This will include a complete cycle of purchase order and request, stock level monitoring and inventory control. The clinic system will cater to the needs of the doctors in terms of their tasks in their specific clinics. This is fully integrated with the Hospital Information System 8, for easy access and data retrieval and update. It also includes subjective, objective, assessment and plan, or SOAP entries, enables prescription printing and visitation scheduling. Lastly, the electronic medical record system provides a solution for managing, maintaining and retrieving patient medical records. It also secures the different patient records, allows annotations and image archiving. And that's the composition of the BizBox hospital system. Each of them specializes with a certain hospital process, which makes them very important in the effectivity and efficiency of the hospital as a whole. That was the end of the video. Thank you for your time and we hope that you learned something from this simple presentation.
So actually, that was the Beats box. So with that 9-minute video, you have already witnessed how it works. It is not just only in the individualized client care management, but it was focused, or it is focused rather on the how the hospital use this platform to operationalize all the processes from admissions, from the admission the department, from the emergency room up to the hospital wards and special areas. And this may entail how they could serve best when it comes to the finance management, materials management, clinical, which is the individualized care management, and on how they attend to other services. When we say hospital information system, as what I have mentioned, this focus on the processes that could be administrative and clinical operations. So what's the difference of the two? When we say administrative processes, this involves the processes outside on the healthcare management of clients, such as what I have mentioned, the finance, billing, central supply, and other processes that is essential when it comes to the operations other than the clinical. If we say clinical, these are the basic informations that can be accessed and processed through the hospital information system that is relevant to client care management, such as charting, diagnostic examination results, patient's history, medication records. These are on the clinical operations. The hospital information system is capable of storing and managing this hospital information that will definitely satisfy the stakeholders. And who are our stakeholders? Our stakeholders are our clients. And indeed, when it comes to the convenience, this promotes efficiency, maximization of resources of the hospital among the healthcare team members. And when it comes to the hospital information system, one of the features of the BITS box is the Health Information Technology Provider, or HITP. Actually, all of us, even nowadays, we have instructed and advised all of you to be members of PhilHealth as essential requirement when it comes to the limited face-to-face classes. If you wish to verify, your active status, there is what we call HITP. When the hospital personnel, admission personnel wish to validate and to verify the status of your PhilHealth contribution, there is the HITP. And the HITP covers the what we call PhilHealth online verification of eligibility. So let's correct the spelling. It's letter E, not I. Eligibility. Eligibility meaning that you are eligible, that the healthcare expenses will be managed and will be covered by the PhilHealth. So this covers the what we call S claims and the E claims. So meaning the E claims could be managed if it is directed, uh, if your claims could be directed to your own accounts using the online transactions. The S claims is referring to the submission of pertinent requirements, wherein the S claims will focus on how you will fill out pertinent data of your information necessary for verification of your online membership. So this is the HITP. So when it comes to the HITP, we have three uh, benefits that you may experience. It reduces the processing time, faster remittance, and saving you from the long processes. So reduces the excuse me. It reduces the processing time simply because if you are going to the central office of the PhilHealth, you need to process it in a long queue. So you will need to proceed first floor, second floor, and other floors of the building to submit merely the pertinent documents. Unlike the use of the health information technology provider or the HITP, you can submit the scanned documents as verified by the hospital personnel. The faster remittance, once approved by the PhilHealth, can be already be transferred so that it will cover your expenses to the hospital. And you may not need anymore to proceed to the central office to have this process when it comes to PhilHealth benefits. Now, this is a typical picture of the health information technology provider. So have the online application entry for the PhilHealth, we have the members information, and we have the patient information. Sir, is there a difference between the member and the patient information? If you are the member, if you are the patient that will cater the services, or who will cater the services of the hospital, then you are at the same time the patient because you are the active member. Because as PhilHealth member, you have also declared dependents. Okay. However, we have been oriented that when it comes to the coverage of the PhilHealth, whenever you will become 21 years old and above, you will be out of the dependent status. So that's why you need to have the application for membership. Now, when it comes to this aspect or perspective of the HITP, these are more convenient on the part of the stakeholders or the clients. How about the SMS notification for doctors? SMS stands for short messaging system. So this is a typical situation wherein you receive text messages from one person to another person. But the difference is that of once you enter, for example, a patient is being admitted in the emergency room under and assigned under your care, automatically you will receive a message of the basic information related to the patient who is being admitted in the emergency room. The doctor may have already the quick preview of the chief complaint, the age, the gender, the complete name, and even the overview of some possible diagnostic examination results. So this is very convenient on the part of the doctor because in emergency situations, if the doctors will still travel going to the hospital, they will already receive notification through the SMS or short messaging system on the basic information of the client. And this is very very important, simply because the doctor can already send orders, or what do you call this, treatment regimen that can be implemented or that can be administered to the client even in his absence, meaning if he's still not arriving in the hospital physically. So that's why the SMS notification for doctors, so the nurse may enter to the inpatient registration form, and if and the doctors may have their own personal ID numbers, and once it entered the ID number of the doctor, so automatically the doctor will receive uh, a message that is relevant to the client. If the client is already admitted in the room, then it will also state what room he is already admitted and the chief complaint, the time of admission, and the date of admission. So this is the short messaging system notification for doctors. How about the balance detection for patients with unsettled account? So if the client will be subject for clearance, there is an alert feature, meaning the client cannot be cleared and be out of the hospital if there are unsettled accounts. And with this, the clients can be updated with their balance, simply because they could just access in their own mobile phones, or even to the applications that they have downloaded connected to the hospital services. So the alert feature will show your balance, because there's a certain cutoff wherein the clients will be informed of the balance when it comes to their own accounts. So when the client will be subject for excuse me, when the client will be subject for discharge, so the client will be notified with the alert feature of this features of the hospital information system. This will monitor financial records through the notification. So I'll be showing to you, yeah, this is the typical balance detection for patients with unsettled accounts. So uh, basically the client, the security personnel or the discharge personnel of the hospital may just have a QR code, and then once they scan the QR code of the client, and it may appear discharge registry account, patient is with unsettled balance. So the admission, or rather the discharge personnel, will not anymore see the paper clearance, but rather the discharge personnel will be alerted once it will be scanned by the barcode or the QR code. It will appear that the client has not been cleared. With the patient's outstanding account balance, it will appear there. You will, once you include the patient name and once you enter the patient ID, it will still appear that there is an outstanding balance. So once the client is already cleared and have settled all these accounts, then it will appear, and it will prompt that the client has been cleared and already settled his account. So another is, we have the inventory stock on hand display. This is one of the important features when it is very useful for nurses, because if nurses rather will carry out orders of doctors, just like medications or drugs to be administered the soonest. Kasi for nurses, usually the morning shift is the one that will secure the stock for the whole 24-hour shift, because on the night shift, not all personnel are available. But with the use of the inventory stock on hand display, it will again prompt the central supply room. It will prompt again the nurse. It will prompt also the nurses if we lack already stock of certain supplies or medication. So it will identify the inventory balance. Actually, once the nurse will enter and request through the hospital information system, he will already identify the inventory balance. If it will lack already for the whole, if it will be insufficient for the whole 24 hours, then eventually the central supply is also on the real time monitoring, and they will request earlier for the stocks of such request from the nurse for the client's consumption. Now, This is a typical example of inventory stock on hand display. So basic information of the client, the patient's name, the ID number, and if you will see on the transaction line items, the nurse will be the one who will definitely have the request of the medications. So we have entered here the description, and if you will see, it already entered the quantity and the amount, the unit price and the total. So this information will already be cascaded once you enter anything in this patient's account. It will also in a real time update the billing statement, the finance, it will update the pharmacy. So synchronize. The services are already synchronized. You don't need to call all of this department that we do not have any more stocks. And I even experienced it during my practice. We do not have yet hospital information system. We just use the telephone and call all of the departments that will be involved when it comes to our requests. So if the personnel is absent, then the person in charge is not available. So that's my problem, because that's rather our problem if it is needed immediately for administration to the patient. So at least it would monitor eventually the flow of the stocks, and the central supply room will already prepare for its stocks, which is sufficient for the next and the following days. So the patient's kiosk is definitely considered as a convenient tool, because the patient can already have a glimpse in one picture of the needed information he may have, such as medical records, diagnostic exam results, appointments, rather consultation schedule of doctors. If the hospital is already in full capacity for admission, so these are very important. Like also for the finance, when it comes to the billing statements, this the patient kiosk already have all of this access. So these are the organized lists which the health benefit providers will allow the patients to track their medical and billing records. Kasi if for example, how much is my bill way back to 2 days ago, so it will track it. The patient's kiosk, it can track. So just like sa mga online banking yan transactions, you can track eventually the transactions of withdrawal and deposit in your own account. So just similar with the patient's kiosk, it can identify the requested medications for the past 5 days, the the billing status for the last 5 days. It can already be accessed through the use of the patient's kiosk. So it will just enter the patient ID, because the patient ID is peculiar to obviously to that patient, and he knows only those, unless the healthcare team is also can also access to it for important information. And it will just enter the surname as well. So we have now the flexible pricing and discount schemes. Okay, why do we need schemes? For example, there are some situations that a client has no pill health. So it may have a different scheme of charges. If the client has pill health, then obviously it must deduct the pill health coverage. If the client is a senior who has the senior citizen, so it must cover a scheme that will facilitate discount of 20%. For disabled also, or PWD rather, persons with disabilities, it may also cover a different scheme of the pricing when it comes to the charges. So these schemes that I'm talking about is called as socialized pricing schemes. Kaya pag socialized pricing schemes, even employees, 'di ba, when their immediate family members or themselves are admitted in the hospital, they have also discounts. So it must have a different price schemes. So meron for regular, meron for PhilHealth, meron for employees, and so on and so forth. And that is what called socialized pricing schemes, which I have mentioned that these are the discount schemes, just like for senior citizens, persons with disabilities, stockholders, and employees may have discounts. And this could be customized through the use of the flexible pricing and discount schemes. Now, this is what we're talking about. That's like for example, in the list of the price scheme, just like here, regular, regular, deluxe, private. Pag regular, deluxe, private, tapos we have regular, ward, private. So, iba yung price scheme doon. Iba rin yung coverage ng PhilHealth. So, if you're aware of HMO or health maintenance organization, there are some limitations when it comes to the coverage. Yeah, that's why if for HMOs, if you are as a what do you call this? If you're a holder of an HMO, please be oriented on the, for example, when it comes to the rate of the rooms, it can only cover specific rate of rooms. If it will be upgraded, then that will be on your own expense na. So that is one that is very important, and you can already access this and be aware and oriented of it. Barcode system. Nowadays, we have faster transaction and easier transaction through the use of barcode and QR code as well. Because even in your own mobile phones, you have your QR code reader and barcode readers. And these are codes that will particularly protect your information. The codes that can be used that can be used actually will also reflect your identity. So that's why there are some instances that the QR code that are being used, instead of typing all the link of the hospital information system, the QR code will direct you already in the platform. So this is a typical example of the barcode system. So we have the barcode, and it will appear here the ID, and automatically you will be directed to the inpatient registration form if you are requested to fill out this online. So these are the barcode system. How about the duplicate detection? When we talk about duplicate detection, there is some instances that the purpose of this is to prevent the errors. So there are some instances that there will be multiple entries. For example, uh, the admission office already entered the basic information of the client. So here comes the nurse. The nurse will again enter because of the problem with the internet connectivity, and upon verification, the nurse in the emergency room saw that it is not yet filled out by the admissions personnel. So the nurse can also have the viewing rights and access to that portal. So, but eventually, if the nurse will already enter in that portal, it may not anymore allow the nurse to enter since it was initially managed and processed by the admissions officers. So it will already be locked. Kaya pag save yon, you cannot anymore alter the information. So that is to prevent yung tinatawag nating duplicate. Kaya from term duplicate, it will enter the same information. So this is to prevent what you call this errors. So that's why it will prompt to you, similar record found for Dewey John. Would you like to proceed? So yun. So it will prompt, and it will alert the person if there's already duplication when it comes to the entry of information. So this is the first part of our topic. So we will now proceed to the topic 6. The topic 6 will cover the electronic health record. So electronic health records are connected with what we call bits box, because if all of these processes are embedded in the hospital information system, then all of the documents can be accessed through the electronic health record. Sir, what's the difference between electronic health records and electronic medical records? For electronic health records, meaning all the information related to the health of the client, okay, related to health of the client, billing, the hospitalization, yan, yung information related to his hospitalization is electronic health records. But if we are talking about electronic medical records, it will concentrate specifically from the time that the client had been admitted, and through the electronic health records, yung records that had been stored from the previous hospitalization can be accessed in general through electronic health records. Pag electronic medical records, this could be supported on the present admissions of the client, and it will just be updated through the use of the electronic health records. To give you a glimpse of how the electronic medical records was established and was used and conceptualized, I will now present to you a video presentation of the history of electronic medical records. This video is also available and had been uploaded also in your Centralino pit stop.
Hey, it's easy to think of electronic medical records as just a substitute for paper record keeping and little else. That kind of limited view obscures the massive advances made in the nature of healthcare today, which has a rich history. A doctor in 1940 transported to today would be shocked at the changes in healthcare due to electronic record keeping, which has changed the course of medical science as we know it. The real history of electronic medical records dates back to the 1960s with problem-oriented medical records. That is, medical records as we understand them today. In the 1960s, Dr. Larry Weed's problem-oriented medical record was a breakthrough in medical recording. This innovation allowed third-party facilities to independently verify the diagnosis. But before Dr. Weed's system, a doctor only had access to their diagnosis and the treatments they provided. Now, new doctors had access to a patient's entire medical history. In 1972, the Regenstrief Institute develops the first EMR system, but the system fails to attract many physicians. But by the late 1980s, low-cost personal computers gave way to widespread adoption of EMRs. Large hospitals can now provide the same level of servicing for each patient without worrying about specific doctor-patient relationships. However, the technology didn't really gain traction with smaller facilities or private practices. Regardless of their adoption rate, many practice management functions, such as billing and scheduling, were being moved to computers. And in the 1990s, the establishment of the internet made accessing health information online easier than ever, setting the stage for web-based EMRs. In 1991, the Institute of Medicine recommended that by year 2000, every physician should be using computers to improve patient care. In 2009, President Barack Obama signs ARRA into law. The American Recovery and Reinvestment Act provided incentives for healthcare facilities who demonstrate meaningful use of electronic medical records. Today, electronic medical records are increasingly paperless. Patient medical records are more accessible than ever before, meaning that data technology is on the verge of becoming fully portable and comprehensive. Even with all the advancements in EMR technology, 70% of physicians are unhappy with their current system. Specialists especially have difficulties adapting to their EMR software due to their different needs and areas of focus. However, EMRs are becoming increasingly specialized for different areas of practice and environments, allowing you to easily streamline workflows, improve data entry, and increase doctor-patient interaction. NetHealth fully believes in creating better outcomes for clients.
Okay, so that was the history of electronic medical records. So even it was established in the United States, and they have considered it into and enacted it into law. So that's why most of the physicians have been mandated to use computers that time. And even going back to 1990s, those are my years during my college education, I have witnessed the first computer that I have seen in my whole life. We're in a huge monitor, just like unlike now, it's flat screen, and we do not have yet laptops then we have the large CPUs, and then on the top of it is the big monitor, the huge monitor, and there's no photo, but it's only text, and the text is colored green. So just like just like Matrix. Okay, just like that. So those are the screens that are like. So can you imagine the time that we are adjusting to the transition? So anyway, That's why it was integrated in our curriculum. During our time, we have computer one. Unlike now, we do have already health informatics because you have been immersed into the use of these gadgets. But anyway, the electronic medical records are the digital versions of the paper charts, meaning the physical paper are now converted into digital versions. This could be viewed even outside the hospital into your own gadgets. And this will contain the general informations of the client. However, this can only be accessed on a perspective that it will protect the hospital and the clients as well. So the viewing rights, will definitely be in control by the chief nursing officer. So aside from these electronic medical records, we have the electronic health records. So the first one is electronic medical records. So this is the digital version. When we talk about electronic health records, it will now involve the access of all the clinicians. The clinicians that we're talking about are the healthcare teams that are greatly involved in the holistic care of the client. Now, when it comes to this, we have considered that electronic health records can reduce, ensure, and enhance. So what does it mean? Reduce errors because it will prompt already to the healthcare team some of the information that may not be relevant or unfilled uh, data in the form, in the electronic forms or electronic platforms. So just like, for example, if in a simple Google survey, if it is required, you cannot proceed to the next phase of the survey. So just a typical setup also when it comes to the electronic health records, that it may reduce errors because there are some features on the of the electronic health records which basically must be needed to complete. And when it comes to the ensure privacy, uh, every institution has in place policies when it comes to data protection because it is already enacted into law. And efficiency is very important because when we say efficiency, we are managing all the available resources that can be useful for patients' treatment. Now, unlike in the usual scenario, the nurses do the manual charting in a paper pencil. Yeah, paper pencil measures or ways. So we have the patient's medical info. So the patient medical info is considered as the electronic patient chart, wherein the nurse, the doctors can just pick the information relevant to the client's assessment, relevant to the client's information. And we can already browse all the basic information from drug history, from the present, from the work impression or initial diagnosis of the client, which is collapsible uh, in one panel. You can retrieve all of it in one. You will not anymore proceed to the next page, just like in a typical physical chart. So this is an example of the patient medical info. So just like here, it already identified the allergies, and it will already alert the nurse. The nurse may not anymore ask the client about the allergies, but it is still very important. Future nurses still remember this. We must not depend only on this platform. The most important to validate is to really ask questions to the client, because there are some informations that may not be considered complete in this platform but can be retrieved through a physical interview. So these informations are necessary, such as a collapsible panel, past conditions and diagnosing, drug history, surgical history, workups history, immunization, personal and social history, family history. So in just one panel, you can access all this basic information. Now, vital signs graph. Okay. If you will be immersed into the clinical areas, you will definitely graph the vital signs, the BP, excuse me, the BP, the heart rate, the RR, and the temperature, so that to check yung every hospitalization day when it comes to the improvement of vital signs of the client. So, but in the vital signs graph, once you enter each data, it can already proceed to analytics. It can give you already a glimpse of the progress of the progress monitoring of the vital signs. So it will not anymore use different colors of ball pens. Okay, so just like here, the latest vital signs is 120 over 139 millimeters mercury. So it will already appear from the time that is indicated below and from the date. So it can already avail what do you call this? It can already be seen in one panel the glimpse of when is the time that the client do have hypotension, hypertension, the patient may do have bradycardia or tachycardia. So this is the vital signs graph. The next is the e-prescription. This is not anymore new to us because in the past years, 2 years, when we do and witness about telehealth and teleconsultations, these are already available. The doctors may just enter basic information and it will be converted into the PDF file of such PDF version of the prescription. So this is just a typical panel wherein the doctor will just enter the medication which is already in the ano yan now, it's already in the menu. It will just parang drop down siya. Tapos it will just enter specifically the dosage, then certain remarks, and yung privacy setting if it is public, meaning public, the client can access, the doctors can access, the nurse can access. So this will appear, for example, Beachbox Medical Center, it appears the name of the doctor and the medication. This could be shown into the pharmacy for you to purchase these medications, and the nurse can also access this as part of the records of the client. So that is what we call e-prescription. How about document management system? If we say document management system, this will entail on tracking. That is the key term, tracking. When you track when you track information needed for the present procedure or present condition of the client, that document management system can provide you. Just like, for example, it's in a remote telehealth consultation, the doctor will educate the client that uh, you have uh, you have an infection in the ear. So eventually in a typical consultation, face-to-face consultation, the doctor can use the audio visual materials, but the doctors can already send photos, digital photos to identify the location of the infection. Then afterwards, when the client will have the feedback and the doctor wants to see the wants to see the consistency and the color of the discharge from the ear, the client can have a photo and can be uploaded through this document management system. So it is just like then in a messenger that you can upload pictures and exchange and share pictures. Pero dito kasi, this is related to the patient's condition to verify and validate because the client nga is in a remote area. The client is not present in the hospital. So on vice versa, if the client is in the hospital and the doctor is not present, he can already have exchange of information, valid information, reliable information through the use of the document management system. How about seamless information exchange? If we say information exchange, we have mentioned about the interoperability standards. It is sharing of information. The healthcare team can electronically receive and exchange notes and documents and even refer to other doctors. So if we say seamless information exchange, for example, I will be the incoming nurse in the afternoon shift. But for me to know the status of admissions and diagnosis of the clients who are admitted in my ward, I can already have the what you call this can coordinate to the outgoing nurse, and you can exchange You can exchange information of the nurse cannot anymore will not anymore type all this basic information, that they can exchange messages when it comes to the number of admissions, number of cases, which they can already shared in one platform. So mabilis na. There's a fast exchange of information through the use of the seamless information exchange. How about the pediatric note growth chart? Okay, we are familiar with the body mass index. Okay, with the body mass index, there's ideal body weight for every age group. Just like for the developmental growth, we expect, I know you have been oriented in the pediatric nursing, that in every development, there are expected skills that the client the pediatric client must manifest. Okay, behaviors. So with the use of the pediatric growth chart, it can automatically the observations of the doctor can be entered, and now it may have a comparative results if the child's age is if the child's age is aligned with the normal range. So that's why with this range, it can already compare of what's the typical and expected height and weight for a 1-year-old child of aging this and having weight. So it can already give you a glimpse if you are out of the normal reference. So this is how the technology works. Data trends. When it comes to data trends, even in your own mobile phones, if you have the settings of receive notifications. If you receive notifications of the updated trends, it will just pop in your mobile phone. So just the same as with the data trends, even using of this hashtag. Yan. So pag hashtag trending So in the hospital, when they use this top trending, for example, yung data trends, highest number of admissions in the emergency room. Magte-trend yan. Pag kinlik lang yung data trends na yan, highest number, top or leading number of admissions or cases, COVID-19. Second, heart diseases. Third, sa hospital lang yun So in just one glimpse, it can give you the idea. So other than that, it can give you also data when it goes back, when you go back and track it for the month, for each month. So for example, how many clients have been admitted with headache, migraine, anorexia for the next 4 months. So it will give you graph. So what is the peak? October. So what's in the October? It will give you analytics. So these are the data trends. So I think we have already completed the topic 6. So I'll just end up my record.